Here we go. I'll be presenting on pre-service, comparing pre-service and in-service training. As you may know, there has been a lot of discussions about pre-service and in-service training, and people claim that pre-service training is cost-effective, more cost-effective than in-service training. But as of today, we don't know that, because there is no data which enables us to compare the cost-effectiveness of these two training modalities. And for us, for USAID delivery in Ethiopia, trainings are a large, major part of our capacity building activities. So we wanted to explore this question further and conducted this easy study to compare the cost effectiveness of these two training modalities. So as I go along through my as I go through my slides, this will be the points that I'll be talking about. You know, before 2006, the pharmaceutical, we had a supply chain system, and the supply chain system that existed then had so many problems. And I believe many of you who have been here, who were here yesterday and the day before, have heard it from my colleagues' presentations. And some of these problems were like unaffordability of products, unavailability of products, and irrational drug use, and many others. And to alleviate these problems, the Ministry of Health recognized these problems and developed a pharmaceutical logistics master plan, which later led to the establishment of the Pharmaceutical Fund and Supply Agency, which works under the Federal Ministry of Affairs, and which is also an autonomous supply chain agency. And later on, this agency developed a single integrated supply chain system, also known as the Integrated Pharmaceutical Logistics System, or IPLS. And through this system, all pharmaceuticals are procured, stored, and distributed centrally at PFSA or through the hubs of PFSA. To implement IPLS, a standard operating procedure and a training curriculum were developed. This training curriculum was mainly about how to fill out the forms which are used to report and request pharmaceuticals. Since 2009, PFSA, along with USA Deliver and other partners like SMS and CHAI, has provided a training on IPLS to more than 12,000 healthcare workers. And the main training modality used to provide this training was the in-service training. The benefit of providing in-service training is that we are sure that the trainees will go to the health facilities right after the training and start implementing the system. But it's also expensive because it has costs that are associated with travel, per diems, and also opportunity costs. People have to leave their site to come to training and attend the training for the duration of the training. On the other hand, pre-service training is less expensive because it doesn't have costs that are associated with the in-service training. But we're not sure whether it's cost-effective or not because, as I said earlier, we didn't have data. So the main objective of this study was to compare the to gather data and compare the cost effectiveness of these two training modalities. And when we start to conduct this study, we provided a training on IPLS to 172 pharmacy degree graduating students of Mekelle and Addis Ababa University in June 2013. the curriculum we used to train these people was the same as the curriculum that we used for in-service training. And also the same trainer cadres were used. A year later, we sent a questionnaire to all 172 participants of the training, asking them about where they are, what they're doing, if they're involved in supply chain, and how their level of supply chain involvement was. And also, we also asked them to rate the training based on how it helped them to carry out their supply chain tasks in their assigned posts. In addition, we calculated and compared the cost of in-service training and pre-service training per trainee. As I said earlier, we sent the questionnaire to all of them, to 172 of them, and 101 of them responded, which we think is fairly representative. From their response, 89 of the trainees were working in the public health sector, and of which 81 of them were also working in service delivery points. This is the place where IPLS is being implemented. And we had also asked them if they had gotten additional training to the training we provided them. And many of, as you can see it from the graph, many of them said no. That means they were using the training that we gave them a year ago to implement the supply chain activities that they had in their assigned posts. And when we also asked them to rate the training from 1 to 5, from a scale of 1 to 5, 1 being the training was completely irrelevant to what they're doing, and 5 being it was quite essential or quite relevant to what they're doing. Many of them, in fact, 88 of them rated it from 3 to 5, which means, in fact, close to 50% of them rated it 5, which means the training that we gave them a year before was very essential to carry out their supply chain activities. While we were comparing the cost, we took the travel, per diems, and opportunity costs into account. And when we calculate the opportunity cost, we consider their salary for the amount, for the duration of the training as an opportunity cost. The cost to train one trainee using IST was $169. And on the other hand, for PST, the cost per participant was $25.5. Discounting, as I said it earlier, many of the participants, of the 101 participants, PST participants, only 89 of them went to public health sector. So discounting for the participants, for the PST participants that went to the private sector, if you calculate the amount or the cost per trainee in PST, it increases to 28.94. So comparing these two numbers, we can say that IST is 5.8 more expensive than PST. And if you divide 100 to 5.8 to calculate the break-even point, it becomes 17%. That means training 100 participants using pre-service training is equal to the cost of training 17 participants using in-service training. So lessons learned, from this study, we learned that PST not only reduces costs, it also reduces the amount of time people have, the healthcare workers have to spend for training. And PST can have an important role also to play, especially in providing IPLS training in our country, in addition to the in-service training we usually use to provide this training. The other thing that I would like to mention here, or something that can be considered as a limitation to this training, is this is based on our experience, and this study is also a representative of the time in which it was done. That means, as you know, many things change over time. So this was done last year, and the numbers could be right if it were only done last year. If somebody tries to replicate this study somewhere with a different per diem rate, with a different hall rent, and with different variables that are considered here, you may not come up with the exact same number, but because this number shows that there is a significant difference, we can say that PST is more cost-effective than IST. And because of this, we are planning to expand our pre-service training to 5 regions of Ethiopia, and we have planned to provide IST training to around 500 people, graduating students by next year. And one of the things that we didn't do here is we didn't measure and compare the effectiveness of both these trainings. We assumed that pre-service